I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, this is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center. Stay tuned, we've got some interesting new technology coming, J-plasma, which we're going to show you some videos on that. It's helium gas that's underneath the skin that helps to tighten up the skin and really just expand upon my extraordinary results already. And we're going to get that within the next week and show you those videos. But anyway, today we got somebody from Southern Jersey come in here with gynecomastia. So he's got, gynecomastia. He's got, so gynecomastia, as I always say, it's not like a disease or an ailment or a diagnosis. It's just, are you happy or unhappy with the size, shape, or look of your chest? So he's got gynecomastia, both gland. He's got some stuff in there. RBs, the meats there. Kind of overdoing that, but he's got fat too. So, and people dish me, oh, why did you tell him to join a gym? Why do you tell him to lose weight, to exercise and diet and eat right? Well, I mean, why wouldn't I, right? Why wouldn't I? Girlfriend here is a nurse, but we're not going to show her face, but why wouldn't I? You're spending good money doing this operation, and I want you to look good and feel good. So eat good, join a gym, right?
Yep.
Are you mad at me for saying that?
No.
I'm
down like
right.
60 pounds.
Right. It's like a doctor, oh, stop smoking. Oh, why do you tell him to stop smoking? Because it's bad for you? So same thing here. I'm doing great work on you. I stand by my work forever. But yeah, do everything right for you. Eat right. We want to get you a sexy back. So we're going to lipo, Vaser, all that stuff. Stealth incisions here, of course, here. And I add a new one on here. People say to me, oh, will that leave a scar? It'll leave a little spot there. It'll look like a mole. It'll look like a little mole there, but that'll etch the lower part of the chest, upper part of the abdomen. And I think it's the whole package from here to here, to here, to here, to everything, not just here. Because you don't want just a flatter chest, you want a sculpted, defined, etched chest, and that's what I deliver. I mean, you can hate me for giving results that are amazing. You can hate me for my fees, but I guarantee my work and my results are extraordinaries. And what do they say? Haters hate us because they ain't us.
Haters because they ain't us.
They don't hate us because they ain't us. They don't hate us because they ain't us.
Anus, get it? Anus. They anus. Come over here. Their asses, no. But, so we're going to do great work. What else are we going to do? That's it. So let's numb them. Oh, a couple other things. Let me just add. Always do the incision here. Don't go to a doctor who's lazy. Do it here. Sure, that's easy to do it here, but it's a little more difficult to do it over here. And there's of course nerves and blood vessels, but I'm a doctor. I went to medical school for many, many years. I know what's there. And the ultrasound technology is excellent. It heats up the skin and it doesn't get the vessels or the nerves or anything. But if you have a scar here, a scar here, a scar here, a scar here, symmetrical, bilateral, people are going to say, oh, you had cosmetic surgery. Put the scar here, and that'll hide it. Put the scar here, because you got to always get out the glands. Also, don't let any doctor say, oh, I can remove the glands through liposuction alone. I invented my own cannulas, special cannulas to get the gland out. That's BS. You need to cut out the gland. If you've seen my videos, and I hope everybody has seen my videos, after I lipo and Vaser and do all that stuff, those glands are impressive. You cannot, they're rubbery, hard. You cannot, even with your own special invention of cannulas, you gotta make this incision. You have to make the incision. You have to always remove the glands. You cannot remove that out of there. So I put my incision here, I make an incision there. You gotta remove the glands. Don't let anybody say you don't. No incision here to offset that. And I do add on a little incision there. If you don't want the incision there, we won't go to the upper abdomen, but 99.999% of my patients want that there. So because they want the upper abs, and that's included in my price. And again, my results are guaranteed. If you need a touch-up, when you need a touch-up, 1 year, 10 years later, there's absolutely no fee. So now, let's mark them. We got midline. Ooh, right down there. We got the lower fold of that breasty. The breasticis. The breasticis. There we go. So that's a little, I don't know what that is. So we got a little, don't want to go above this because I want to maintain fullness up on top. So don't go above there. We got the delto pectoral gruvola. Delto pectoral gruvola. So we got the pectoralis inferior medial, pectoralis lateral. We got Seth Rogen in Neighbors 1. Neighbors 2. Remember this Seth Rogen? Kind of look like Seth Rogen. All right. Enough of that fun. So this is my transition zone there. Okay, so let's find his six-pack. Do you have a six-pack? Oh, the semilunar lines. Let's get that. You think he's got a six-pack somewhere here?
I can see it.
Is it somewhere? Do you have it? Where's that six-pack? All right, I think I see it. Let's see, do it again. Do a little crunchy. So this is something going on right there. That's a line. So that's probably this is the bottom six-pack. So the first six-pack is above there somewhere. So I think it's up here. What do you think? It's about here? Make it crunchy? Crunch roller? What do you think? Something like this? That's the top?
Sure.
Maybe? You think?
It is now.
It is now. It's gotta be. It's gotta be.
We pump you up.
To pump you up.
We pump you up.
You like that? Also, see your nipples are kind of inverted.
Yeah.
That's the tethering of the gland. That'll go away. When I see the tethering.
Yeah.
That's kind of a very. That's the gland that's been tethered. The nipple has been tethered. See, that's kind of a very interesting thing, and that's a perfect example of why you got to remove the gland. This is ground zero, and without that, and you can't liposuction that. So don't let any lazy doctor say, "Oh, I invented special cannulas to do it." BS. Got my two ringy dingies. Armpit, not over here. Don't let any doctor say, "Oh, we're gonna do it here." We do in the armpit. It's hidden. Stealth incision. And by protectors so I don't burn the skin. And let's have some fun. So here I'm diving deep. I'm diving to get that nice, and with my smart hand, I'm sculpting this. And this is what you want. You don't want liposuction. No liposuction here. Lipo-sculpting.
So what are you thinking? Big link?
No, I think they're fatty. Let's suck you out.
Suck you out.
We suck you out. There's a sculpture behind every block of stone, and it's the job of the sculptor to reveal it. Something like that. So there's a sculpture here in this block, and I'm revealing it. So this is really kind of defines the deltoids and the upper pecs. That's all I'm doing. It's a wonderful day in the neighborhood, a wonderful day in the neighborhood. Would you be mine? Would you be mine? Would you be my patient?
Would you be mine? Could you be mine? Won't you be my neighbor?
All right, so Dr. Jonathan Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center, which I'm the best in gynecomastia surgery. Come to me, I go beyond. So, stealth incisions, right in the armpit. That's where I do 90% of my work. I don't go here. Do not go here, because you don't want to scar here and here. Bilateral, it looks like you had surgery. In the armpit, nobody sees it. It puts down the arm, nobody will see it. I do 90%, plus I can curve and contour the lateral aspect of the pectoralis muscle and the lats down here, give you that gorgeous negative space. Now he's swollen here. He's swollen, he's got 4 liters of fluid that I used on him, but I sculpted him to perfection. Vaser, Power X, regular liposuction, curved cannulas all around here. The lateral and inferior aspect of the pecs, the lats, the upper abdomen, little incision there that heals up like a little mole, only one. And I curved his 6-packs, 1, 2, 3, 4, 5, 6. I didn't go down there because he didn't pay for it. You pay for it, I'll do that. Nah, this is enough. This you work on yourself. Stealth incisions, obviously on both sides. Now, he's awake, so he's gonna get out of here literally in minutes. Now make a muscle. There you go. Hercules, look at that. So show him the pre-op right now, bunk, and here is the post-op right now, right there. Now do a little crunch-a-rooney. There you go, the 6-pack, and he's gonna look amazing. And somebody gave me crap because I said diet and exercise. You know something? Yes, diet and exercise. The person who commented that I'm obsessed with fitness, well, you know something? The hell with you. I am. I give my patients the best, and I expect the best from them. I want nothing but the best from me and from my patients, right?
Yep.
Right, so he is gonna diet, he is gonna exercise, he's gonna get his sexy back. Not that he ever lost it. He's gonna get his mojo back. Not that he ever lost it. And he's gonna look better than ever, even better than you were in high school, right? Even better than high school. if that's possible. Look at this space here. Look at this side. Unbelievable. Just a slope out of here, fullness there, and just a great slope out of there. Make a muscle again on this side. There you go. Looks amazing. So if you have gynecomastia, look at this. This is 400 something there. Look at that. That's 2.5 liters right there. 2.5 liters plus another 400. 3 liters of fat on them. These are the glands that I was able to whittle down. This right there, that's one gland. That's the other gland. And don't let anybody not take out the glands, because you have this sitting underneath the nipple. It looks like a puffy nipple. Get that out. Don't leave it in there. So if you have gynecomastia, you're going to call me, Dr. Lebowitz, 631-424-0101. Too close. 631-424-0101, where I promise you I'll take absolute, fantastic, unbelievable care of you. Thank you and hope to see you soon.